Historically, people said that they would look at the plant and they would communicate to the plant. The plant would say something like, use me. And we would say, we're not sure how to use you, but we will begin the process. And then as it unfolds and we're processing the medicine, a patient shows up and says, I have this problem. The medical world has no solution. Can you help me? And we will think about it and maybe pray about it or meditate about it. And then we will say, let's try this. And then this trial and error process can reveal whether we're successful or not, whether the herb is successful or not. In my case, I've been through this process. And then following that, I immediately start to research that plant when I've discovered how powerful it is. And the one that I just described to you or demonstrated to you, that's how I started with that plant. It spoke to me in my garden. I began to use it for patients. Doctors said they have nothing like that. But historically, trial and error, intuition. I started to define our ways of knowing, indigenous ways of knowing about 15 years ago. And, very similar to Chinese medicine and Western medicine. The first way of knowing is to na-na, or to look and to observe. I skipped the Hawaiian words for you guys, but the second one is to listen. And the third one is to ask questions, get some history, get some feedback. And another one is to use your sense of touch. We even have using the sense of smell and intuition. And then, of course, we have trials. So that describes all of our indigenous ways of knowing that we practice in order to uncover solutions for healthcare problems. This is going to be part of the new tradition, this ways of knowing that I just described to you. A friend of mine calls me up. He says, oh, my daughter is constipated. She's very small toddler, and she hasn't gone to the bathroom in days and days. Is there anything you can do? So I said, come and meet me in the garden. I met him in the garden, and I took her hand, and I walked with her through the garden, and we were speaking. She reached up and grabbed the fruit from the tree and began eating it. The father came over there and told me, stop her, she's eating that fruit. I said, let her eat the fruit. Anyway, after that, they went home. I called him back. I said, how's it going? He says, perfect. She went to the bathroom. Okay, in this case, the infant, the toddler, who couldn't even speak, selected the appropriate solution for her problem. That's just one story. There's so many. About 12 or so years ago, I was confronted with the issue of working with academia and dealing with the concept of complementary and alternative medicine. Personally, I find that confusing and misleading. So I suggested that we use a new term, integrative medicine. Over time, medical schools across the country, the United States, began to change the name of their department from complementary and alternative medicine to integrative medicine and healthcare. Okay, this is a pretty good, sign of evolution. We need to recognize that our world of using pharmaceuticals is not the whole world. Most of the world does not use pharmaceuticals. They use plants. I work with the local medical system. That we have many patients that we work with. Many of them are not inclined to use any plant-based medicines. So we're not going to go against their belief system. We're going to work within our own belief system and people who share that belief system. And if we're going to treat a patient with a specific complaint, sometimes they don't know what the problem is. So we need to investigate. We need to do an assessment. And then we need to discover what kind of herbal treatment is appropriate for them, or a combination of herbal treatment and what we call Ho'oponopono, which is another system of healing. It helps to heal relationships. and also manual medicine. We have Lomi Lomi. We combine all of those things to do Hawaiian healing medicine. So they help to address psychosocial issues that the patient or the patient's family may have.